Hello, great afternoon out there to our spirit plant medicine community, conscious living network world, and anybody out there on the worldwide web of interest. My name is Marc Caron with Conscious Living Network and the Spirit Plant Medicine Conference. And today I have great pleasure to be here with, first off, my co-organizer and good friend now, Stephen Gray, with the Spirit Plant Medicine Conference, author of Cannabis and Spirituality, and a guy who knows his way around the medicine world. And today we're honored to have Dr. St Arnault with us. She's a naturopathic physician and co-founder of Empower Health Clinic, and she specializes in transformative and integrative health solutions. And today we're going to be talking about, this is the first of our pre-Spirit Plant Medicine Conference Facebook Live interview series, where we're going to be discussing and speaking with a number of our speakers over the next 6 weeks before the conference. And Ray's going to be part of a panel on the Friday afternoon.
Did we lose him?
Event. No, we're all still here, I think. And so Ray's going to be here as part of the panel and talking about ketamine and ketamine-assisted psychotherapy. So, Dr. Ray, welcome to our program.
Ray, can you hear us?
I can hear you. I can't hear Marc. He's gone for me.
Well, while we're waiting for Marc to come back, perhaps I could just cut in for a moment and explain to people briefly what that event is that your panel is going to be part of. Mm-hmm. So we've added a new segment to the conference for the first time this year, and it's taking place on Friday, November 1st from 1 to 5. It's part of the conference, but it's a brand new thing. When we found out we needed to, we had the space for the whole day, we thought we'd put some programming in, and we came up with this theme, Psychedelics in Society, Skillfully Navigating the Forward Path. So we've created 4 hour-long panel discussions, one on cannabis and its current situation and where it's going and all that, one on psilocybin, one on underground psychotherapy with the problems associated with that and so on, and the one that you've actually put together for us. So back to you.
Thanks. Looks like Marc's back there.
Yay!
Yeah. So, did you want me to just introduce myself a little bit here then?
Yeah. Tell us about yourself, Dr. Ray.
Yeah.
Kind of what got you into what you're doing and what you're working on today, especially in regards to the ketamine-assisted psychotherapy.
Yeah, so I'm a naturopathic physician, as you mentioned. I've been in practice for about 7 years now, and I definitely have had a long time interest in transformational healing. And so it's not just psychedelics, but anything that can take people from a place of thinking that they need fixing for the rest of their lives to the knowledge that we are all whole at our cores, and that transformation and healing is possible. So I think that the integration of what we think of as traditional integrative medicine with more transformational healing modalities has been a question that myself and my team has been looking for the answer to for a long time. And I think where we see a real disconnect is in the sort of mind-body medicine counseling and sort of psych therapies over here, and then the other physical healing modalities over here, and trying to bring those things together into, healing the whole person and not discounting them on either side, and creating cross collaboration between the disciplines. So not just medical disciplines like regular, traditional or conventional medicine, but also naturopathic medicine, Chinese medicine, and also all of the other alternative. And I don't actually even like to use the word alternative, but very important healing modalities that people have access to. And so way back in 2014, my fellow co-founder of Empower Health, Helen Lashni, and I got together a team of professionals that has since evolved over the last 5 years to really answer that question, like how do we work together very integratively, like truly integratively. So not just, opening up an office and having people be sort of siloed into their offices and just, under one roof, as opposed to actually communicating and talking and working as a team to solve somebody's health and wellness issues. Definitely psychedelic medicine has been a big part of my own personal healing journeys. To date, there has not been legal access to psychedelic medicine, but what it has taught me is that you can actually recreate some of these the healing modalities within a clinic setting through breath work and meditation and coaching and other, what we consider cathartic or peak experiences. And you can actually create those experiences consciously in your life, as opposed to unconsciously. What happens often in our life is our traumas, transition, death, big things that disrupt our life pattern or cause pattern interrupts. And, instead of having, in those moments, we have a choice to heal or to regress. And with the right approach and therapies, we can actually really help people get through those experiences. So it's been, psychedelics have informed my own personal way of approaching healthcare. And we're always finding ways to potentially make these things legally accessible to people. But, in the meantime, when it comes to ketamine, this is something that, most people haven't really had on their radar as a psychotherapeutic tool, even though it has a very long history in use in psychotherapy. And so I think that's something that was very much of interest to me, is what's happening on a global scale right now with ketamine. And where did it come from, and why is it unique or different from other substances that are out there? So that's where my interest comes in it, so that's sort of just a little nutshell what has led me to this place today, or led me to be interested in this topic. So.
Well, so you just fired out 3 questions that we could just turn around and fire back at you. Did you want to start with, obviously we're going to dig into the ketamine issue here. So do you want to start with saying a little bit about what the project is, or can you talk about that today?
So right now there's not like a formal project. It's just a group of people who are interested in answering the questions around ethics and safe use and best practices with regards to use of ketamine for psychotherapy. And this isn't just, by the way, happening in British Columbia, it's also happening across the United States. So there's actually networks of people and conferences and organizations and clinics and research facilities, all over North America right now who are concerned with these questions. So I think right now that's the long and short of what's actually happening right now. And right now it's a bit of an awareness thing of like, what is the potential clinical benefit of ketamine, because it's very different than other psychedelics and how it works that makes it very suitable to a clinic environment. Yeah. So
what is it then?
Exactly. Yeah, ketamine.
Before we go any further,
got you there ketamine? First, Marc.
I know. Well, the reason I asked, and I was really shocked as I got into this world, the first time I'd ever heard of ketamine was, from recreational use. And I heard it was a horse tranquilizer. And the first thing that came to my mind is, why would anybody want to do that? And, from what I've learned now since, it's much more than just a horse tranquilizer. So maybe you can tell us what it is, maybe a bit of its history, and, what it's used for.
Yeah. So the interesting thing about that particular meme, where that came from, is that there's actually another molecule, and I don't have my notes in front of me. I'm sorry, my brain is full of a lot of other things right now, but certainly these are the things that we will talk about at the actual conference itself if we get a chance. But the horse tranquilizer was actually another molecule or a derivative, or something that ketamine came from. So it actually is a falsely attributed to that name, but it is used. It's an actual what's called a dissociative anesthetic. It works very differently than other anesthetics. It has a very high safety profile, and I think this is why ketamine gets confusing, right? Because it's used recreationally, it's used in anesthesia, right? It's used in psychedelic psychotherapy, so it actually has a real wide range of applications. The other thing with ketamine is it attaches to glutamate receptors, which also is another interesting chemical fact for ketamine that has a number of different implications. Glutamate receptors are all over the body. And for some reason, and this is actually, there may be, there's other people who actually know a lot more about it than me in this regard, but it's why it actually has a full body effect, right? Because there are glutamate receptors all over the body. It's considered a very safe medication. So in talking with anesthesiologists and ER doctors, the dosing range is really wide. So it's often used in the ER. It's used quite extensively in pediatric settings, in other higher risk settings. And it has a couple of cautionary side effects that you have to take into account, of course. But
such
definitely.
As?
So it can elevate heart rate and blood pressure. So for people who have heart conditions, you have to be aware of that, be monitoring that. And it can also potentially cause what's called laryngospasm, which is a tightening or constriction of the larynx or the throat. So the person will have difficulty breathing. And in particular, if they're sedated, right, you're going to either watch them go blue or cough or whatever. Apparently, though, that is a self-regulating phenomenon. So actually, that will actually release when the body is hypoxic enough. Again, not a risk that we all like to take, but again, if you're, say, doing this in an office setting, you have the right emergency equipment standing by and the right people that know what to do if something like that were to happen. So there are, like I said, stuff like that, and that's, to be honest, most medications of any kind where you have, the difference here, again, well, this is the age-old thing with pharmaceuticals versus plants, right? Like plants are pharmaceuticals essentially, but they're hundreds of pharmaceuticals in one, right? And what we've done in modern medicine is we've taken out one ingredient, and used that. Now, ketamine is synthetically synthesized. And to be honest, that is something I've wanted to dig into. And there's other people who have been digging into this for me. I actually don't know what the history of how it was synthesized. So I don't know where it comes from. I'm sure there's some plant origin somewhere way back down the line, but it truly is a synthetic drug. But yeah, so somebody else again might know more about that than me at this time. But anyway. Yeah, go ahead.
Ask a question about that, before we get into the stuff where we're really going with this for the most part. Yeah. But what comes to mind is that as you say, there are people all over the continent and elsewhere working to examine this substance, this chemical, and get it more attention, get it perhaps recognized in a variety of ways, and so on. As that happens, and it becomes to the attention of the public more. Is there a danger that it would get out into the street and like LSD, for example, could it be a corrupted formula, or like MDMA, where you get all kinds of other things, or even the opioids where fentanyl and carfentanil get into it? Is that like? And I suppose what I'm asking is, how easy is it for some underground person to just make this stuff?
I'm not sure about making it, to be perfectly honest. I don't think ketamine is easy to make, but I do know it's very easily accessible on the street. It is a very common street drug, commonly known as Special K. It's definitely very, very commonly used in the party scenes in lower doses. And is
it usually actually ketamine, or can it
actually ketamine, and the common sort of layperson's term for whether desirable or not, going deep with it, is called the K-hole, the famous K-hole. So, and that, interestingly, the K-hole is what you're going for with a psychedelic experience. So, that's the interesting piece to that. Like, that's not necessarily desirable on a dance floor. So it is very commonly or easy to access on the streets. And of course, any white powdered substance in BC, beware. I again, not the expert here, but I am, I would be very careful myself, if at all, trying to access it that way. But people are going to access it. So it's about really good. There's people out there that really specialize in that kind of, harm reduction, right? In terms of people's drug uses. And it has a very, by the way, low addiction potential, but there are anecdotal counts of ketamine addiction, but it's not nearly it doesn't have nearly the addiction profile as other street drugs. That's for sure. but certainly it has.
I'm really glad you mentioned that about, just the street side of things, because it's so important in today's, what's happening in today's world, especially in the downtown east side and the fentanyl crisis and things of that nature, that, it's super important that anytime, like you were saying, you get a white powdery substance, make sure you get it tested. And there's a number of places that will test your stuff for you if that's who you are and you're out there. But it's just, I'm glad you brought that up, Dr. Ray, because it's really important.
Yeah. And I mean, as a naturopathic doctor, that's, what I'm often doing is working with people on the other side of that, whether it's helping people with withdrawal symptoms of not ketamine in particular, but a lot of other things. And that does bring up one of ketamine's uses. And this is very, again, typical for psychedelic substances, is using a substance to come off of a substance. And there are some promising initial studies and results done on ketamine and addiction. I know for sure there are studies done on alcoholism. I can't quote them exactly right now, but again, if we want to plug some resources in after, maybe there's people even viewing this right now who might want to post some links for people. Yeah, I am definitely not the ketamine expert, but here when it comes to all of the research that's out there for it right now. But yeah, so ketamine, as any mind-altering psychedelic substance or empathogen at a lower dose, does have some really promising potential there for treating not just addiction but many other conditions. So so interesting.
You talk about PTSD and depression and things of that nature. Is there a way to explain how that works, or is it just that it works?
You know what? The interesting thing about ketamine, and that I have sort of come across and what people have told me, is that it has both, there's both a subjective effect that occurs when used in the context of psychotherapy. So you have insights and sort of transformational processes, or, that come out of the actual psychedelic or psychotherapeutic aspect of the use. But you also have studies that have been done on things like depression, which don't necessarily involve psychotherapy, where the drug has actually had a lasting effect on things like depression. So it appears to actually have a chemical as well as psychotherapeutic effect, and so, and a lot of this evidence is coming from IV use, for example, of ketamine, where you have the person on a low dose drip, and you're specifically keeping it at a sub transformational or sub psychedelic dose, maybe slightly euphoric, but you're not going for that more dissociative experience or transformational experience. But so these people are getting effects with things like depression. So I think that part was really interesting to me. And I don't know what the data is for other psychedelics, but it's possible that all psychedelics have that effect. But the difference with ketamine acting on is there a difference because it's acting on the glutamate receptors versus the serotonin receptors, which is where all the other classic psychedelics fall into.
Yeah, correct me if I'm off on the wrong track on this one, but I would think that this is maybe a larger question that could be extended as well. But for starters, I would think that if it's the chemical aspect of antidepressant benefits would have a lifespan, a shelf life, so to speak, I would imagine. For example, Iboga has that potential as well. It's described as having both a powerful insight qualities, but also having an actual chemical effect that if you come in ibogaine, particularly clinic, for example, and you're in the grip of a heroin addiction, it actually knocks out, like physiologically, the craving for the drug for, I'm told, up to several weeks. However, what they say is that then becomes a window of opportunity for you to make changes in your life situation, because if you don't, then eventually that capability fades and you're back to the same situation. Do you know anything about that?
Yes,
ketamine?
And yes. So I think that there's there's going to be a lifespan to anything, I think, where you have effects that are chemical, because you go into the same, the way I approach psychotherapy and the body, being a naturopathic doctor, the mind and body aren't separate, right? So a chemical, and I consider your family environment part of your chemical environment, right? So, but I get what you're saying, right?
There, right?
Yeah, biochemistry, right? Yeah. So I think that if you go back into the same biochemical and environmental conditions and social conditions that you came from with any drug or anything, whether it's an antidepressant or a whatever it is, psychedelic, the risk to fall backwards is the same. I mean, nutritional factors, that, brain factors, all kinds of things. So yes, I agree with you. And I think, and again, I would have to look into this further, but I think that there's a difference between, there's a window because you had an insight, and a difference because there was a chemical actual brain state. And exactly, I think that there's actually a chemical brain state change that is different with ketamine versus the other ones, because again, they're showing this at low doses with that, so it's being prescribed essentially in the medical model of prescribing a drug, as opposed to using it as a tool to assist psychotherapy. And that is like those are very distinct ways of prescribing these substances. And another classic example might be, again, I'm not an expert, but microdosing a substance versus taking something at a higher dose like LSD or something like that. So there's studies that are showing the difference there. So, showing that there's actually something happening at a subclinical level or a subperceptual level that's still happening, right, in the background. So that's some of the studies that were coming out with ketamine.
So can you talk about the other component of it then? For example, in the Johns Hopkins studies from the early 2000s, where they worked with terminal patients, cancer patients and whatnot. What changed for them, especially the ones that had the most, what they called mystical experiences, was they just got this sort of truth serum and larger perspective, where they saw themselves as being connected to the whole and to, the spirit and so on. And then they weren't so worried about their particular condition, and they just changed their attitude altogether. So in what ways is ketamine similar, or perhaps even different from some of the kind of things that psilocybin and ayahuasca can do this as well? LSD sometimes can do this as well. Peyote certainly does this. This is why people come into the Native American church and change their lives out of drug addiction and so on, because they're shown of a larger reality, as well as insight into their own particular, mindset. So can you talk about that, please?
Absolutely. This is where I had the epiphany. I had no idea of its psychedelic potential. And in my own personal experience with this, it was very obvious that this is a highly overlooked substance on the roster here. And it absolutely has very classical psychedelic properties. So I would, personally, I put it somewhere in between DMT and a mushroom trip. So like the length of time that you're in that more dissociative or transformational or psychedelic state is about, the whole experience might be an hour to an hour and a half, but the peak experience is maybe 20 to 40 minutes, depending on sensitivity. Is
this oral ingestion?
This is intramuscular injection. So this is actually part of the conversation here. There's different ways that ketamine can be in different methods of delivery, right? And right now, just so you know, it has been approved by the FDA as for intranasal use in the psychiatrist's office for use during psychotherapy. And intranasal is like a step. So there's sublingual, so lozenge. There's intranasal. There's intramuscular, and there's IV. And even though intramuscular is injected, it's different. It has a different both safety profile and effect from IV, but it's a little bit faster acting than, say, if you do a sublingual or intranasal, and you can get I believe, and again, these things, because every person is different how they react to drugs, right? But you get a much faster onset, like a very clear, what I experienced as a launch, right? You launch the same way that you launch with something like a DMT experience. So yeah, so very, very much similar, slightly longer acting. So you get a little bit more time in the transformational space, but you're not so long in the experience like mushrooms, for example, that you're spending the entire day there. So, and this is where, I'm interested personally, in terms of accessibility of these medicines and settings that these medicines could be done in, hypothetically speaking, of course. I'm interested in it because it's a perfect medicine for a clinical context. And just because, it's short, it's long acting enough to get a good transformational experience and a result, but it's not so long acting that it's difficult to, say, set up sessions or have somebody. So expensive, right? Because the big cost, I think, what they're facing, I think, in the MAPS stuff going on in the US right now is 2 therapists for many hours. What's the accessibility of that? What's the cost of that, right? For somebody.
Excellent point. Oh yeah, very important. Yeah, definitely.
That's the interesting thing, and if I may, guys, I think it's important to talk about that, because when we take a look at all of these medicines now, especially when you look at iboga and all these abilities that they have to help people, it becomes that affordability factor to reach many people. So it's not something that's effective and that works has got to be affordable and reachable to the many. Right? It's for those who need it and not be unaffordable. Absolutely.
And that's why ketamine really interests me. It's very cheap, and it's, it already is an approved drug. It's already used on label in the US for psychiatric conditions. And it's just a matter of, it's just a matter of getting the culture on board with this and to see where we can go with it. But yeah, it has a long history of use. So it's not like it's coming out of nowhere. So as far as actually where do we look for evidence and best practices, like I said, there's a long history of use back into the 60s of using this as a psychedelic substance.
So in a therapeutic environment, like you were referring to a few moments ago there, let's say you come in as the patient or the client, and you're working with a therapist, psychotherapist, whatever, and you take some ketamine. What is the kind of what's the sort of the situation that might happen? I mean, are you going to talk? Are you going to sit there in silence and go deep inside and then come out and talk about it at the end? And is the person just functioning during that deep experience part as a sitter, where they talk about LSD sitters? Basically, they leave you alone. They just make sure you're safe, maybe put good music on. How do you see the protocol for therapeutic context as a possibility for ketamine? I'm sure there's many ways to do it, but do you have any? Yeah, what do you think?
Yeah, so a bit of a little, checkbox D, all of the above. And I think that's the other really unique piece about ketamine, is that the effect, while can differ from person to person, once somebody's quote unquote sensitivity is established, the dosing can be very predictable in terms of how, far a therapeutic session will go. And so there are, by the way, there's probably as many protocols as there are clinics, and most of them, again, are in the US right now. But there are certain clinics that might, in particular, Phil Wolfson down in the US, he has the Ketamine Training Center as well as the Ketamine Research Foundation. And he also hosts a network of practitioners. What he does with people is he test dose a lozenge, between 100 to 300 milligrams in one session, sublingually, fast acting or fast dissolving. And that you basically start with 100 milligrams and you see what the effect is, and then the patient can decide whether or not to go up from there. And so this is again where the art comes in terms of the psychotherapist and or the medical professionals that are involved in prescribing. So basically, depending on the effect that person gets, they can get a very deep effect, slightly slower onset from the sublingual, but definitely get a very valuable experience. And then from there, they might determine what dose they're going to give in intramuscular for the next session. And either way, so at the lower dose, it's going to most likely be, that's that in the lower doses. So if you don't go high, you can actually get more of an MDMA-like effect. So it's more of an empathogen. You might be able to talk about what's going on for you, and you actually can do more psychotherapy during that session. So it depends what kind, how you're setting up the protocol. But intramuscular, not so much. So first of all, even on a lozenge, people can be totally incapacitated and aren't going to want to talk. But again, as somebody comes out, re-enters, so to speak, you can definitely have some talk therapy, or you might want to save that for another session, right? Like, so the whole point of any, I think, proper and ethical delivery of psychedelic medicine is integration. So it's not like you have to solve everything in one visit. And then just to get back to the intramuscular injection, yeah, that's like you're just making sure the person's breathing, coming back, right? And they're literally in another universe, and then come back, and we'll, at that point, yes, there might be some conversation needed to integrate them just on that day or from that session, but a lot of that, the lessons will just be like with other psychedelics, come over time or through their ongoing integration work. So yeah, it's definitely you can get a lot of different experiences. There are actually people who are using it for things like.
What happened, guys? We lost you both.
I'm here.
Really? I'm here, I think. Can you hear me, here. Ray?
I can hear you, Stephen.
Yeah, I can hear you, Marc. Can you hear us? Well, maybe. Yeah, you've had few times where it did the 3, 2, 1 ding thing, Marc.
I don't know what happened out there. I don't know if anyone can continue hearing.
Well, maybe we're still on, Ray. So in the meantime, let me ask you a little bit more about these the high dose kinds of experiences. I mentioned before we started that I'd read something, and I don't remember the details, 40 years or more ago, by John Lilly, talking about high dose ketamine experiences where I seem to remember him talking about like being in truly alien worlds or something like that. I mean, what are the kinds of experiences, are people finding that they can have experiences that are quite similar or quite different from LSD, psilocybin, peyote, and ayahuasca, for example?
I think ketamine, it's just like any psychedelic, like every person's experience is totally different, like totally, right? The person sitting next to you is completely different. There tends to be themes that emerge, and this is actually something that Phil Wolfson's quite passionate about. He likes to go over some of those themes, and there's definitely water type themes that emerge, soaring, surfing the universe, definitely aliens can come back up, family things can come up. I personally, I felt like I just got sucked backwards through a wormhole and was just shown image after image of things. It was almost like I'd be going through a wormhole and then stop in a universe and check it out. But I was never in an alien world. I was always on Earth and trees. And I think that's where, your own personal experiences, your own, what's inside you, what needs to be worked out inside you is what's going to come out, possibly the environment you're in, right? The specific memories that you have to deal with, right? So yeah, there's like, I just like people get, very godlike experiences, mystical experiences, oneness, unity, love, connection. It's really, the one thing that I find unique, just from my own, again, personal experiences, is it's really a lot more gentle than some of the other ones. So it's very profound, but I think possibly because it has a slightly anesthetic capacity, I didn't feel any body discomfort. There are some people, by the way, nausea, and it's not as common as say things like ayahuasca, but if you get that, you're sensitive to it, and that really sucks. There actually are some anti-nauseant medications that can be taken ahead of time. That's not fun. It's definitely like a drug reaction to the actual ketamine. Just not pleasant. But anyway, I feel that it's a much more gentle experience. So even though you launch quite quickly, it's not the like soul body ripping experience of a DMT trip. For most people, right? Like there's a sense of safety there. I've had it described to me. I've had it described to me by a good friend as a warm hug. There's a lot of feminine energy with ketamine for a lot of people. Relational stuff, you know, people going to tribally type and ancestry connecting experiences. It's there's a lot of variation, but I think there's like, it's like all the psychedelics have their bubbles, and then there's this big overlap in the middle. Like you get all those similar mystical type oneness experiences, and then you might get the other thing that comes, I think, up more with ketamine are just a monotone, experiences where it's just gray, whereas like a lot of the other psychedelics might be way more on the colorful side of things. But it's not that somebody couldn't experience colorful with ketamine, but it's less likely to get, say, black and white gray voids as much as, say, with ketamine. And maybe that's when it's bordering, by the way, when it gets to be high doses, like very high doses, when like they use in anesthetics, like you go beyond the psychedelic experience into like total anesthesia, maybe that's just because somebody's approaching that borderline there, right? So so again, it's I'm a baby when it comes to this stuff. Like I only have my maybe 3 or 4 personal experiences and just talking to a lot of people, but yeah, it's really got my interest because I didn't realize actually how classically psychedelic it was. And then when I find it, so it's absolutely got a lot of potential in that side of things, and needs to be definitely looked at from that perspective more.
Does it deplete you in the same way that MDMA does for a couple of days after, typically?
No. Most people may or may not feel pretty tired after the experience that day, possibly just lingering sedative effects. But in general, people bounce back. There's not that sort of depression hangover. That's, I think, again, I'm disclaimer. I don't know this for sure, but to me, I think the serotonin ones are a bit harder on the nervous system from that kind of neurotransmitter depleting type effect. And I don't know if it's because it's a glutamate receptor agonist that it's different, but that's one of the differences. Again, it doesn't have that sort of lagging. Again, everybody's different. Some people are just wiped out the next day, but it's not so much of a brain wipeout. It's just a fatigue, like they might just be fatigued. So you're not depressed like with some of the other ones, Yeah,
fascinating. Yeah. Is it in a category of its own, like Salvia divinorum? There's no other chemical like it. It's not in the classical psychedelic realm at all. And then there's, psilocybin and all these other ones. They're all very similar in the tryptamine category. Is it a whole other thing? Yeah.
Totally on its own. Yeah. Yeah. I think there's iboga as its own category. You've got the tryptamine / serotonin, like serotonin analogs, and then I didn't even think of the salvia, but and then you've got ketamine, and I'm off the top of my head. Well, I mean, even MDMA is in the serotonin side of things. Yeah.
Phenethylamine, is that that category? Yeah. Anyway, MDMA. I mean, Marc, are we with you? Are you there, Marc? Marc?
He just says to continue. He'll be able to finish.
Oh, okay.
He's not able to hear in real time, so he just says to continue.
Oh, I guess it's just you and I for now then, is it?
Yes.
Yeah.
We can see Marc.
Right. So have you covered the different kind of treatment modalities and options that you would see going forward with this medicine?
Yeah, well, I think that just comes down to looking at
we can
hear you now.
Back?
You're back.
Is Marc back?
No, maybe you can't hear us.
We can see and hear you, but
can you guys hear me though?
Hear us.
Yes. Yeah. Anyway, you were going to say, Ray, we better carry on like this.
Oh yeah, totally. So I think again, looking at best practices that are currently being done all over North America right now, and looking at what the patient populations are, and looking at the type of therapist that you have involved, that's going to definitely inform. The type of protocols and therapies that you do, right? So there's really basic stuff around dosing and all that kind of stuff that has to just be, obviously medically sound. and also all the safety stuff and emergency stuff and all that other stuff. But as far as the actual therapy and what happens in a therapy session, how often you give treatments, over what period of time, that's where you're going to get some variation. So, one, sort of possible standard protocol is, you do at least 3 sessions once a week, and then you might, you do psychotherapy in between, and then ongoing either individual or group integration, those kinds of classic things. And I think the definite word on the street is ketamine is, well, I would say this is for all psychedelics, but just, because we're talking about ketamine, never done in isolation of other therapy, right? It's a tool among many psychotherapeutic tools that can be used to help people. And I think I don't personally ascribe to the idea of a psychedelic of any kind being the magic bullet for somebody. So yeah, it's just, I think that, have a team around you, have therapists around you, have a plan, all those other things to look after, your mental and physical well-being after your sessions. So yeah, I think that's where, using ketamine inside of a bigger context or a bigger healing context is really important. Like for me anyway. Yeah.
Yeah, great. Do you see any indication that it's moving into or likely to move into the kind of ways that people are in what you might call the underground, working with ceremonial use of ayahuasca, psilocybin, and some other substances? Is there any indication that we're going to start seeing ketamine circles?
Underground ketamine circles?
Yeah.
Who knows if they're already happening, right? Like that's
Right.
The nature of the underground. It's definitely it's interesting though how those two things have been totally disconnected. It's because it's very widely used recreationally. So why aren't we seeing ketamine circles? I don't know. I think maybe because other psychedelics are also very easily accessible underground as well. That could be why. And I actually don't know. I don't know. I mean, interestingly, you wouldn't be wanting to inject it. So number one, that's not cool. But yeah, so injecting something in a non-medical setting, do that at your own risk and get help potentially. So yeah, I personally think that has to be done in a actual clinical setting, that piece of it. But from a intranasal or lozenge perspective or sublingual perspective, those doses are what we call more the euphoric doses or the transpersonal doses where conversation and stuff can happen. Forget about the underground. That can also be an official group setting of a tool. And again, there are people that do this in a group setting, a group healing session officially already. So, so that would be more of the equivalent of it. Yeah. And whether people bring in traditional tools, that's the thing. Again, who's giving it? That's going to give you the flavor, right? That's going to give you the flavor of how it's being delivered. To me, there's no reason, that this couldn't be used in a more traditional, or bringing in more traditional elements and have basically the drug facilitate the mental change needed to drop into your body, let go of your fears, all those other things to get into a more healing frame of mind. So
very interesting. But so just to be clear for anyone watching this, the oral dosages, like the lozenge that you were talking about, for example, that's not going to result in, a true sort of ego dissolving, quote, other sort of experience, unless you maybe eat a lot of them or something like that.
Yeah. Some people have very, very strong effects from the lozenges from what I've heard. So yeah, they can get close to what we call the intramuscular experience on a lozenge. But again, it's not like 100% that have people that get there. And again, because it's some of it's going oral and down the throat, could cause a bit more nausea that way at higher doses as well. So, and again, there's debate as to whether the nausea is something centrally caused, like in the brain, or if it's something that's caused in the gut. But yeah, so, you know, you start to get a lot in your mouth. And it really tastes disgusting. That's the other piece.
Well, we know it's good then.
yeah, right.
Right up there with ayahuasca, is it?
Yeah, totally, right. So yeah. It's like medicines, right? Any good medicine.
Yeah, that's right.
Yeah.
Wonderful. Yeah.
Yeah.
Well, it's fascinating. I just wanted to mention to people watching this. This has been a wonderful conversation so far. Thank you very much. That along with the panel that you're going to be more or less, well, you've put together, but you'll be on at the Spirit Plant Medicine Conference on the afternoon of Friday, November 1st. One of the other ones addresses some of the kinds of issues we're talking about here, which is it's going to be called Underground Psychedelic Psychotherapy, Problems and Promise, and really going to be looking at, you know, how these other psychedelics are being used these days and the kinds of issues around all that. So that's just want to let people know that this is going to be a fascinating afternoon, but, you know, for all of these 4 panel discussions.
Yeah. And Marc's just messaging me that we want to talk about the panel a little bit. So just so you guys all know, if you want to join the fun with us on that Friday of the conference, we have some, you know, awesome people joining us that know quite a bit more about ketamine than I do. It's just a special interest of mine. And so we have Kate Browning. She's a registered nurse, and she's also doing her doctoral work to become a psychologist. And she's also has her formal training in midwifery as well. And she also runs coordinates the holistic health program at Langara College, and she's also done a lot of papers and just research synthesis on ketamine, and also knows Dr. Phil Wolfson really well down in the US. So she's a really amazing human to come here speak. And we also have Dr. Neil Hannon, who's an MD psychiatrist from Kelowna, and he also is a clinical assistant professor at UBC. He's also has experience in ketamine-assisted psychotherapy. And we also have Dr. Ian Mitchell. He's also an MD in emergency medicine, and he's also an associate professor of emergency medicine at UBC as well in Kamloops. And so we've got some really interesting perspectives on, you know, the current and different uses of ketamine, and also just how that fits into ketamine-assisted psychotherapy as being different than the sort of medical uses of it. So yeah, so definitely I hope that you guys can come see that with us, sign up for that. And I'm not sure, Stephen, Marc also wanted you to mention that there's a discount code watching for the people watching today. For a $33 discount on the conference, and that's capital FBL33, capitals F, capital B, capital L 33. So I'm not sure if you have the if you can actually put that into the comments or something, but yeah. So just that just came through on text from Stephen or from Marc. Sorry, Marc. Yeah, from Marc.
No worries. Yeah. Yeah. Well, unfortunate that we lost Marc on this, but it didn't really keep us from continuing to have a very interesting conversation. And I hope it all comes through properly. But perhaps we should close it up now. I don't know if there's any tricks here. If we just put stop camera and it ends for us or what. But I'll just mention again to people that first of all, thank you very much to Dr. St Arnault for your fascinating work and knowledge and your ability to articulate it in very understandable ways. Thank you, Ray. And again, this is a new and really exciting, we're really excited about this new program that we've added to the Spirit Plant Medicine Conference, beginning at 1 p.m. on Friday, November 1st, and the conference runs right through until the end of Sunday. And the tickets for the conference conference are available at spiritplantmedicine.com. There's a ticket page there. So I hope people will come. This is a really important event for the future of these substances and for humanity altogether, I dare say, because these substances, when they're used skillfully, as you've heard from Dr. Arnault today, have immense potential for healing. I really like what you said earlier, Ray, about this is a view that we hold as well, and that these psychedelic substances are known for, is that they heal at multiple levels, holistically speaking, right?
Mm-hmm. Yeah, absolutely. Yeah, and they're just, they're part of our pharmacopoeia, and there's a lot of people working hard to make these things accessible, these very safe medicines accessible. So thank you very much for having me.
It sounds fascinating. I really like the sounds of this gentle but still powerful
Tell me about it.
Quality. Yeah. No,
Tell me about it.
Yes, I'd like to tell you about it after I've experienced it. Yeah. Okay. Well, again, thanks very much. The only way I know to get out of this at this point is to stop the camera. So that's what I'm going to do from my end.
I'll text Stephen that we're finished.
To Marc, you mean? Yeah.
You guys are becoming interchangeable to me. All right.
Oh, yeah, we are. We're